Hello, everybody. My name is Cutberto Hernandez, and today I'll be showcasing my experience as a GHI scholar in Sydney, Australia. So, for a little bit about me, as previously established, my name is Cutberto Hernandez, and I am a second-year Master's of Public Health student concentrating in global health at the Mel and Enid Zuckerman College of Public Health. And I am a Global Health Institute Scholar, or GHI Scholar. I'm part of the 2024 cohort. And here's a picture of me. Here's me in the Blue Mountains National Park. I was doing the Three Sisters hike, and the park is about an hour west of Sydney. And quite frankly, it's one of the best hikes that I've ever been to. And as an avid hiker myself, this was an incredible experience that I knew I didn't want to miss. So I'm very, very lucky to have gone on this wonderful hike. So my summer or my winter at a glance starts when I was identified as a GHI scholar and matched with the University of Technology Sydney School of Public Health, or UTS. My site preceptor is Dr. John Adams, who is the deputy head of research at the School of Public Health. And I was and still am currently enrolled in the Allen study, stroke survivorship and self-care study. The length of my stay in Sydney was around 2 months within the margin of June to July of 2024. So the Allen study is an initiative led by UTS researchers and with Dr. Adams as a spearhead. It is a long-term cohort study that is designed to assess the health and health outcomes of people who are currently living post-stroke or people who have endured a stroke, with the goal of creating a database that will aid in policymaking, practice remodeling in order to procure the well-being of those living post-stroke. And self-care is an essential part of this initiative. So the cohort consists of 1,000 Australian residents, and at the moment, this figure is still working or being worked towards. Recruitment efforts are still ongoing, and here's some of the recruitment criteria, which is that participants must speak and read English fluently, over the age of 18, living in New South Wales, Australia, and have had a stroke in the past. So my role as a research assistant was to manage websites related to the Allen study, aid in marketing, supervision of, and even the creation of some social media sites, flyers, banners, postcards that were distributed to certain agencies such as New South Wales Health, as well as contacting as educational institutions and public health organizations in and around Australia about the ongoing study for promotion and, to ensure that the goal of the study reached the majority of Australia, particularly people living in New South Wales. And finally, conducting some literature reviews about the current efforts for establishing self-care as a prevention method, which is, again, one of the core values of the Allen study. Here's some pictures from my work. Here's level 8. Here's me conducting an analysis of what needs to be done in order to recruit or make information more available to people who may be interacting with our social media sites. And over here's a view of my cubicle. Here is the website that I manage, which is allenstudyuts.com. And I've separated my key takeaways from this experience into a research academic side and some personal takeaways. The number one is that research is nonlinear, and in fact, is as systematic as it can be. The results section or discussion section is often very abstract and requires a lot of resiliency, and our outcomes are typically not very favorable depending on whether you're working with certain participants, cohorts. It's very much all about resiliency and about remaining flexible and ensuring that whatever outcomes you get, you can adapt and ultimately learn from them, or if they're favorable, continue on to assess what worked and what didn't. So it's a lot of analysis, a lot of assessments, and I take that as a wonderful opportunity that I learned a lot from. And as a visitor, it is very important to have an open mind and a lot of gratitude and curiosity. I am very, very grateful for this experience, and I didn't think that I would love Australia as much as I did, and I see myself going back there at some point in my life. So this wouldn't be a presentation without some pictures. As someone who's a visual learner, I believe this is a favor that I should be providing. So here is the University of Sydney. It was about a minute walk from my Airbnb actually, and UTS was about 15. So it was a little bit ironic that I got to visit the USyd so many times and went on so many walks around the campus. Here's Bondi Beach. Here is UTS, and then across the street is Central Park Mall, which also doubles as an apartment complex. Haymarket in New South Wales. Here's Darling Harbour. Here is the view of the Sydney Opera House from under the Harbor Bridge and a kangaroo course from Taronga Zoo in Sydney. Here is a park that was really close to where I was living, and so many parks, so many green areas within Sydney that was wonderful to see, especially during the winter, that many plants were blossoming, and it was unlike anything I've ever seen. And here are some pictures of the Sydney Harbour National Park. Here's another hike that I took over during my time there. And the iconic Harbour Bridge as well. And the Opera House is actually opposite from here. And here is the Art Gallery of New South Wales. And I got to visit Melbourne during my time there, which I was very lucky to visit. So here is the State Library of Victoria, St. Kilda Beach, the view from the Shrine of Remembrance of Melbourne, and one of the many coffees that I consumed in Melbourne, which has one of the best cafe cultures in the world. So I will finally leave you here with this wonderful picture that I took on my second to last day in Sydney of the Opera House from the Pylon Lookout. And it was just one of the most magical days that I had just to myself and explored so much. And I'm very, very grateful for the experience. Thank you all for watching. Have a great rest of your day or night.